be it establishment of the poison center, be it collaborations on research in several areas, or leading in doing work in telemedicine, digital health, or therapeutic cells. So several of these is great work which is being done by Nepali diaspora was mentioned here, and all of them also mentioned the challenges faced by them in each of the presenters, but also what are the opportunities, and therefore these discussions and the last panel discussions, which was very intensive, which may give hope to the investors to invest in the health sector, demonstrated by people who have already invested a huge amount of money in that. So following that, I just want to close with 3 points from my side. One is on health workers, second is on the high out-of-pocket expenditure faced by Nepalese citizens, and the third is on if we have to achieve universal health care, what we need to do in ensuring primary health care is there. So health workers are the backbone of every health system. More, as mentioned by Dr. Tedros also, more than 1 in 5 doctors in many high-income countries are migrants, which shows that the growing interdependence of health systems. And health worker migration poses problems for many countries, but it can also have benefits. Many low and lower middle income countries are facing an acute health workforce shortage. This is in part due to lack of adequate investment in education and training of health workers. Investment in continuous learning for health workforce is therefore imperative for health system strengthening. Health system can only function when health workers provide quality of care. Evidence shows that diaspora health workers can contribute to strengthening health system in their country of origin. These include knowledge and skill transfer, support for health education, support for salaries, providing free or subsidized services during visits, home or supporting emergency response. And the 10-point declaration summary of this highlighted all of these issues and the commitment by the Ministry of Health to facilitate this going forward. A number of low and middle income countries have shown through their pioneering public policies that basic health care for all can be provided at a remarkably good level at a very low cost if the society, including the political and intellectual leadership, can get its acts together. And the intellectual leadership that the Nepali diaspora have also will contribute towards this to ensure that health care in Nepal is provided to the citizens of Nepal at a low and affordable cost. Now, on out-of-pocket spending in all over the world accounts for more than 40% of health expenditure, especially in low-income countries. And in 30 low and lower middle-income countries, it is still dominant source of financing for health, including for Nepal, where out-of-pocket expenditure is 56%. The high out-of-pocket spending on health means that 1 in 8 people are having to choose between basic necessities and access to health care. And this is further exacerbated in people who have difficulties or disabilities. For example, just to quote an example, a 26-year-old woman who is pregnant and deaf, if she tries to access healthcare at a private sector, the costs are pretty high. But if she wants to go to the public health sector, maybe the distance she has to travel incurs cost. But also because she is deaf, you will need a person who will need to translate for her. So access to healthcare costs are also very high in that regard. So higher healthcare costs deepen health inequities for persons with disabilities and place them at a higher risk of poverty. Ensuring the rights and the needs of persons with disabilities is essential for countries to achieve health for all. So healthcare shouldn't push people into poverty. It is important to focus on the universal healthcare model based on a conceptualization of primary healthcare as a public good. This will require that the delivery of care is dominated by public providers with public accountability for the quality, efficiency, equitable resource allocation and population health-oriented healthcare. Financing must remain tax-based on social insurance with a progressive movement towards single-payer funding. I think all of these issues have been discussed in detail and will be detailed during the next few years, and especially with this current minister bringing in new initiatives to ensure that healthcare to the people of Nepal is provided at an affordable cost, which is of quality. Thank you and namaste.